My most important job is I am a dad. I have two kids. One of them is 1 year old as of yesterday. One of them is 3 years old. And the reason I share that is because I have a very strong vested interest in the content of today's session, which is ensuring well-being in a digital world. My children are growing up in a world that I did not. I did not live on apps as a child or as a teenager. My children will, and in fact, they're going to be engaging in content and in technologies that are still evolving.
Today's discussion was a powerful coming together of experts from different fields. We had Harvard talking about expert-based content. We had the WHO talking about the power of community. And Maybelline represented what a brand can do in terms of impact and reach.
The things I've learned new today, listening to some of the other panel members, is some of the creators, the problems that the creators have got, and how they manage to talk about authenticity, making sure that what they're providing is actually coming from credible sources of health information and accurate.
And I'll just tell you a little bit about FIDES. FIDES is this incredible network of about 800 healthcare professionals, doctors, nurses, public health officials, who are on social media platforms and who create content. What we at the WHO have done is brought them together.
They come and give us this information, and they have saved me a couple of hours of research, and I have that content, the information, and I make my content much easier. So one of my jobs is to upskill them, empower them with all the tips that I've learned throughout my journey to be able to go out there and raise healthy content.
The World Health Organization is a long-standing, credible partner in the field of public health. They've been able to offer great expertise to the community at large, and we want to make sure we try to bring that expertise into our community so they can access reliable, evidence-based information on mental health.
Our research has shown that if you give creators evidence-based supports, they will carry that support into their content and distribute it widely on a platform like TikTok.
At Maybelline New York, we are the experts in beauty, but we are not the experts in mental health. We believe that we can add value to our community, but we want to be connected with the experts. So we have partnered with the WHO Foundation in order to be connected to the experts on the ground. They are creating a community of care, and they can allow us to increase our impact and our reach.
Stories really matter. In medical fields, we tend to use a lot of data, statistics to sound smart. But if we just kept it simple and started with a story, we would connect to so many more people.